The most common ankle injury that we see is the rolled ankle, the lateral ligament damage. We refer to it as an inversion injury, very common in soccer, netball, football, any active sport. It's when you roll your ankle and you damage the ligaments out here. Now, we see a lot of people get to what we call rehabilitated to pain-free and nearly functional, but then we see them sustain re-injuries. Now the little program I'm going to show you today is to get you to the point where you don't re-injure, the end stage of ankle rehab. One of the things we see is that the nerves that run down the lateral leg can become stuck in the damaged area. We refer to that as neural tethering. With that, you lose some of your proprioception, the awareness of where your ankle is in space when you're weight bearing, and sometimes that precipitates a re-injury. One of the things I'd like to show you is a mobilisation technique for that nerve, and we use a belt of some kind. Bring your leg up, you're taking up the tension of the sciatic system, the nerves down the back of your leg, and when you roll your leg in, if you have any of this neural tethering, you'll feel the stretch through the lateral ankle and up the side of your leg. And it's just a simple repetition of movement to glide or floss the nerve to get it loosening up through that damaged area. And it'll loosen up, and then the nerve will fire more normally, and you'll regain some of that reactivity in proprioception and protective muscle action. 15-20 seconds of that is sufficient, and you could do that a few times a week until it's clear. And then I'd like to show you a couple of other things. When we have an ankle injury, quite often we see that your calf muscle becomes tightened and you tend to be on your toes earlier. So one of the things you can do is to ensure that you can do a good calf stretch, making sure your knee is fully straight and you've got the pressure through the back of your heel and bringing your hips forward and feeling that stretch. And to judge, put the good leg, the one that isn't injured, beside and just check it if it has any more mobility. You want to make sure that both legs are equally flexible and you're getting rid of any of that maintained tightness following the ankle injury. The other thing we want you to do is to do some stability work, and the best way to do that is to use a wobble board. Getting on carefully, we don't need you to fall off. Keeping the edges on the ground initially and just going round and round. To start with, getting your balance, getting your control, and then you can practice going forward and back, trying to get the control, going side to side, controlling the movement, doing a diagonal, getting that control, using all that muscle, all those muscles that control the different positions of your ankle. When you're on a playing field and you hit a divot, you want your foot to be able to adjust to that and have stability. Once you've mastered doing 2 feet, you can practice trying to get the whole thing off the ground and just balancing. Again, getting those muscles working. And once you've done that, you can work at coming up and being able to do single leg balancing on a wobble board. It's impossible to go round completely on the edge because this way it's too hard on your ankle for most of us. So just balancing, going forward and back and round the outside edge and building up your endurance of being able to balance. And with that, you will develop more control around your ankle, reactivate the muscles that protect your ankle through ranges of movement, and hopefully not be one of those people who describes, I have a bad ankle. We want your ankles to be good again. So think about the end stage of an ankle injury. 3 months after injury is when we need to be doing this stuff. Good luck.